Hello, my name is Henna and you are watching Citra's live interview and Periscope. Today we are shooting in English because we have a special guest, Malene Hojstedt Kristensen. Am I correct?
Yeah, you're correct.
Yeah, and we are talking about health data issues. Before we had a seminar where we discussed about these health data issues and how could we manage and how could we use the big data even more better especially in the healthcare and welfare issues. So in Denmark you have this kind of health data program as well. We do also have our ICQs program, but you have this kind of program also, right?
Yes.
And so what's up in Denmark? What are you doing right now with these health data issues?
At the moment, we are really looking into making it more efficient to use data, make it easier, make it faster, and be better to combine data. And the big issue right now is making the foundation correct, making sure that we have the organization and the data governance correct, and that we actually have an efficient platform.
Okay.
So we actually have the foundation correct, otherwise it's going to be hard to use the data afterwards.
So do you already have the foundation?
No, we're working on the foundation.
You are working on it?
We have a program that runs until 2018. So at the first period we have been working around how to make the framework and the prototypes. And now we are doing the production, now we are starting. And the first thing we're starting with is the platform and the national Danish patient register, the modernization of that.
Yeah.
So that's the first thing is the platform, making an efficient platform for the future use.
Okay, and it's correct because we have discussed it before that we have so much information. We have this information flow, and we have our healthcare and our welfare and our souls, and what is it? Something like blood types and whatsoever, biobanks and there are these things. But right now you talk that you are going to create the foundation. So I think you are already like the front runners or in these kind of issues. And it's not the first thing. I think usually you Danish people are always in like top fields. Why is it? Why you are so progressive?
On this area.
Yeah.
I think there's a history of documentations in healthcare.
Okay.
And we have a lot of data, and we have had it in a long time, and we have it in a same structured, standardized way. And then we have a lot of data around that.
Yeah.
I would like to combine it with. So I think that's the history that we actually have the National Patient Register since 1977.
1977.
Yeah, so that if you want to go back and you can actually look back, and you can't see when I was born, but you can see when you were born, and you can follow your, see if you have been in hospital since then, since you were born.
I think it's pretty common in the Scandinavian countries. We have these social identity cards, and it's not in every country, I think so.
No, but what you can see in the National Patient Register is that you can see which kind of diagnosis you've been treated for, what kind of treatment you have. So it's all reported by ICD-10 codes at the moment, and structured, and the Nordic operation code system as well. So it's structured data, so it's where you are able to actually extract information in a structured way.
Okay.
So it's not just text that's structured.
It's not that, it's just...
No.
Okay, so progressive Danish. But we are quite progressive as well in this health data issues. We are a little bit late, so this is not our, like, the biggest thing, right? We're not that, like, timing, but we are in this health data program. We have this ICQs project that we discussed also in the seminar today.
In Finnish.
In Finnish, yeah, ICQs in Finnish. Sorry that you didn't probably understand a word of it, but we have this kind of you have read about it, and we have this kind of plans that we want to create this health data hub or a center that combines everything, like probably as well as you do. But what do you think if we come first? What do you think of our
I think
plans?
that your plan sounds good, and I heard a little bit more about it at the HIMSS conference in February.
Okay.
Where I also heard that you have some initiative that was or research project that was quite interesting, because you were also combining it with the data that you actually can measure in your watch or whatever.
Yeah, from wearables and
Wearables, yeah. So, and that we don't have that in Denmark, and I think that was a very interesting thing, that you actually go upon for the my personal care. What have I gathered of information and steps and blood pressure, all that things. That was quite interesting. I think Denmark has been a research field in Denmark, doing research by registrations, and I think that's also one of the issues. That's the reasons why we actually are a little bit in front.
Okay.
But having a lot of data is not the same as using it.
That's true.
So what you can have a little bit of data, and you can use it a lot for many purposes. And in Denmark we have a lot of data, but I don't think we have a lot of use. We have a lot of research on it, but not use.
I think we have the same problem. Yeah.
So we have. I think that's one of the issues on both sides, is that we actually have a lot of data to use.
And how do we communicate it to people, and how do we because people are a little bit afraid of these kind of issues. So how do we win with this? And it's
I think that you need the storytelling on why it's important that my information is available. I think, and when I go to my doctor, I will also like to know how other people have succeeded with this treatment. So if I should take a decision about my knee, I would like to know if people my age and my gender and everything, have they had a successful treatment or not? So I could actually take my decision upon that. So I think that we have to tell a story of why it's important that we have this information, and also the information that if there is something that is changing rapidly in the population health, we can actually see in the data, and we can act upon it.
I think that was very important reminding, and we should also remember this in Finland, that how do we communicate it, how do we do the storytelling with these health data processes. But first things first, all the Finnish people, we always want to know what foreign people think of Finland. So, what do you think of Finland?
I've been to Finland a couple of times actually. Yeah.
Nice.
I actually like it here. I both like your chocolate and actually a lot of the
Greetings to Patser.
But I think that I always enjoyed my visit here. And I have been staying here for weeks actually. So I know the city quite well of Helsinki. I haven't seen the rest of Finland, but I would love to.
This is nice way to stop the interview, that we are like, nice to hear. Do you watch ice hockey? Probably not.
No, not ice hockey.
Okay.
But I go to the sauna every winter and everything, so I'm a little bit Finnish.
Little bit Finnish. I think you can have our passport. Okay. Hey, thank you all. If you want to know about more of these data programs in Denmark, you can visit. Do you have a website or something?
Actually, we don't have it in English. A little bit embarrassing, but we don't.
Well, we have I think something in Sitra.fi. We have something in there. ICQs. If you do the hashtags ICQs, probably you find something in there also. Okay, but there is something that we should do better.
Yeah, what we should do better.
Okay.
Do it in English.
Yeah. Okay, kiitos, thank you, and in Danish.
Tack.
It's tack.
Yeah.
Tack.
Tack.
Kiitos.
Tack.
Tack.
Kiitos.